What should a phlebotomist do if a patient refuses a blood draw? A. Ignore the patient. B. Restrain the patient. C. Notify the nurse or physician. D. Document but continue the draw. Answer: C. If a patient refuses, you must respect their rights and notify the appropriate medical staff. Forced draws are unethical and could result in legal consequences. Which vein is most preferred for venipuncture? A. Cephalic. B. Basilic. C. Median cubital. D. Radial. Answer: C. The median cubital vein is large, stable, and easiest to access. It also has fewer nearby nerves and arteries, making it safer. What is the primary purpose of using a tourniquet during venipuncture? A. Increase blood pressure. B. Reduce pain. C. Make veins more prominent. D. Prevent blood flow. Answer: C. A tourniquet helps fill the veins with blood, improving visibility and palpation. This makes vein selection and successful insertion more accurate. Which tube color is used for coagulation tests? A. Green. B. Red. C. Light blue. D. Lavender. Answer: C. Light blue tubes contain sodium citrate to prevent clotting. They are essential for accurate PT, PTT, and other coagulation tests. How long should pressure be applied after needle removal? A. 5 seconds. B. 15 seconds. C. 1 to 2 minutes. D. 10 minutes. Answer: C. Applying pressure for 1 to 2 minutes helps seal the puncture site. This reduces the chance of hematoma or continuous bleeding. Why is it important to mix additive tubes gently? A. To dissolve additives. B. To prevent hemolysis. C. To keep blood warm. D. To activate clotting. Answer: B. Gentle inversion ensures additives mix properly with blood. Vigorous shaking can damage red blood cells, causing hemolysis. Which lab test requires a chain of custody? A. Liver function. B. Drug screen. C. CBC. D. Glucose test. Answer: B. Drug screens must follow strict chain of custody protocols. This ensures legal traceability and integrity of the specimen. What should be done if a hematoma forms during venipuncture? A. Keep drawing. B. Apply pressure and stop. C. Ignore it. D. Change tubes. Answer: B. A hematoma indicates leakage under the skin. Stop the draw immediately and apply pressure to minimize swelling. What is the angle of insertion for venipuncture? A. 10 to 15 degrees. B. 30 to 45 degrees. C. 15 to 30 degrees. D. 45 to 60 degrees. Answer: C. 15 to 30 degrees is the safest angle to enter the vein without penetrating through it. This minimizes trauma and improves collection success. Which test is most affected by hemolysis? A. Glucose. B. Potassium. C. Cholesterol. D. Calcium. Answer: B. Hemolysis causes red blood cells to rupture, releasing potassium. This can falsely elevate results and affect patient diagnosis. What additive is found in lavender top tubes? A. Sodium citrate. B. Heparin. C. EDTA. D. Fluoride. Answer: C. EDTA prevents blood clotting by binding calcium. It is ideal for hematology because it preserves cell structure. What is the purpose of the gray top tube? A. Coagulation testing. B. Blood typing. C. Glucose preservation. D. Electrolyte testing. Answer: C. Gray top tubes prevent glucose breakdown. Sodium fluoride and potassium oxalate inhibit glycolysis. What is the first action after a needle stick injury? A. Report to supervisor. B. Finish the procedure. C. Wash the site. D. Go home. Answer: C. Immediately wash the area with soap and water. Then report to your supervisor and follow exposure protocol. Which is a sign of nerve involvement during venipuncture? A. Slow blood flow. B. Shooting pain. C. Hematoma. D. Fainting. Answer: B. Sharp, shooting pain or tingling may mean nerve contact. Remove the needle and document the incident. What should you do if a patient is not wearing an ID bracelet? A. Ask for their name. B. Draw anyway. C. Confirm with nurse. D. Write your own ID. Answer: C. Always verify identity through proper channels. Never proceed without an ID bracelet in place. Which specimen should be kept on ice during transport? A. Blood culture. B. Potassium. C. Lactic acid. D. Bilirubin. Answer: C. Lactic acid is temperature sensitive. Ice transport prevents false elevation from ongoing metabolism. Which sample must be protected from light? A. Calcium. B. Ammonia. C. Bilirubin. D. Sodium. Answer: C. Light breaks down bilirubin in the tube. Shielding it ensures reliable test results for liver function. Which department would handle a CBC test? A. Microbiology. B. Chemistry. C. Coagulation. D. Hematology. Answer: D. A CBC measures red, white cells, and platelets. These are processed and analyzed in hematology. What is the safest way to dispose of a used needle? A. In a biohazard bag. B. On a tray. C. Recap it. D. In a sharps container. Answer: D. Dispose of needles immediately in sharps containers. Recapping increases the risk of accidental sticks. Which tube should be drawn first using the CLSI order of draw? A. Green. B. Light blue. C. Lavender. D. Yellow, SPS. Answer: D. Yellow, SPS, is for blood cultures and drawn first. This avoids contamination from other additives. Why must blood cultures be collected before other tubes? A. To avoid clotting. B. To prevent contamination. C. To save time. D. To reduce patient pain. Answer: B. Blood culture tubes are sterile and contamination can alter results. Drawing them first prevents carryover from additives in other tubes. Which vein should be avoided due to proximity to nerves and arteries? A. Median cubital. B. Cephalic. C. Basilic. D. External jugular. Answer: C. The basilic vein runs near the brachial artery and median nerve. It is used only when safer options are unavailable. What is the recommended site for heel stick in an infant? A. Center of heel. B. Arch of foot. C. Lateral plantar surface. D. Toes. Answer: C. The lateral plantar surface avoids bone and nerves. Using other areas can cause serious injury or infection. What error can result from vigorous shaking of blood tubes? A. Hemolysis. B. Hemoconcentration. C. Clotting. D. Delayed coagulation. Answer: A. Shaking damages red cells, leading to hemolysis. This causes inaccurate potassium and enzyme test results. Why is it critical to check tube expiration dates? A. For color coding. B. To verify patient info. C. To avoid clotting issues. D. To ensure additive effectiveness. Answer: D. Expired tubes may lose vacuum or have degraded additives. This affects blood collection and test reliability. What causes hemoconcentration during phlebotomy? A. Fainting. B. Short needle. C. Tourniquet left on too long. D. Underfilled tube. Answer: C. A prolonged tourniquet restricts venous flow, concentrating cells. This skews test values like protein or hematocrit. When drawing for multiple tubes, which should be filled first? A. EDTA. B. Serum. C. Blood cultures. D. Heparin. Answer: C. Blood cultures require sterile conditions. Filling them first minimizes the risk of cross-contamination. What is the maximum depth for infant heel sticks? A. 2.5 millimeters. B. 3.0 millimeters. C. 0.5 millimeters. D. 2.0 millimeters. Answer: D. Going deeper than 2.0 millimeters can damage bone or nerves. The safest practice is to use shallow lancets approved for infants. Which of the following can result in a rejected specimen? A. Correct tube, no label. B. Chilled glucose tube. C. Light protected bilirubin. D. Inverted EDTA tube. Answer: A. Any unlabeled specimen is automatically rejected for safety. Accurate identification is essential for valid results. Which action is improper when labeling tubes? A. Labeling before draw. B. Using patient's ID. C. Writing with permanent ink. D. Labeling in front of patient. Answer: A. Labeling before the draw risks mix-ups. Always label tubes after collection, in front of the patient, to ensure accuracy. What is the effect of underfilling a light blue tube? A. Hemolysis. B. Test dilution. C. Incorrect coagulation results. D. No effect. Answer: C. The ratio of blood to sodium citrate is critical. Underfilling distorts test results like PT and APTT. How should tubes with anticoagulants be mixed? A. Shake 10 times. B. Stir with needle. C. Leave untouched. D. Invert gently 8 to 10 times. Answer: D. Gentle inversion ensures proper mixing without damaging cells. Never shake or stir, as it causes hemolysis. What is the first choice for capillary puncture in adults? A. Earlobe. B. Thumb. C. Index finger. D. Middle or ring finger. Answer: D. The middle and ring fingers provide adequate blood flow. Other fingers are avoided due to calluses or nerves. Why is it necessary to wipe away the first drop of capillary blood? A. It's too small. B. Contains alcohol. C. Contains tissue fluid. D. It clots fast. Answer: C. The first drop may be diluted with interstitial fluid. Wiping ensures a more accurate sample for testing. What is the consequence of drawing blood from a hematoma? A. Altered test results. B. Improved flow. C. Clearer sample. D. Reduced patient pain. Answer: A. Hematomas contain pooled blood mixed with tissue fluid. This contaminates the sample and skews lab results. Why should ammonia samples be transported on ice? A. To prevent clotting. B. To stabilize the protein. C. To slow down metabolism. D. To protect cell membranes. Answer: C. Cold temperature halts metabolic processes. This prevents artificial elevation of ammonia levels. When is it appropriate to use a syringe for blood collection? A. Always. B. For deep or fragile veins. C. For routine draws. D. For children only. Answer: B. Syringes allow better control of pressure. They are useful for collapsing or small veins where vacutainers may cause damage. What is the last tube drawn in the standard CLSI order of draw? A. Lavender. B. Gray. C. Green. D. Red. Answer: B. Gray top tubes are drawn last to prevent interference from fluoride and oxalate with other tests. Which lab test result is most sensitive to time of collection? A. Hemoglobin. B. Glucose. C. Cortisol. D. Potassium. Answer: C. Cortisol levels follow a circadian rhythm. Time of collection must be documented for accurate interpretation. What is the purpose of performing a timed glucose tolerance test? A. Assess liver function. B. Evaluate pancreas function. C. Test for anemia. D. Determine infection. Answer: B. GTT monitors how the body processes sugar. It helps diagnose conditions like diabetes or insulin resistance. Why is the bevel of the needle placed up during venipuncture? A. To increase pain. B. To reduce air bubbles. C. For better vein entry. D. For faster blood flow. Answer: C. A bevel-up approach allows smoother penetration. It reduces trauma and increases success rate of the draw. When must a phlebotomist wear gloves? A. During blood draw only. B. When handling urine. C. When touching equipment. D. Anytime blood or body fluids may be encountered. Answer: D. Gloves protect both patient and phlebotomist from infection. Use them with any potential fluid contact. What does a positive Allen test indicate? A. Arterial blood flow is adequate. B. Veins are collapsed. C. Tourniquet is too tight. D. Fistula is working. Answer: A. The Allen test checks for ulnar artery patency. A positive result means safe to draw arterial samples from the radial artery. What is a critical step when drawing blood from a patient with 4? A. Draw above the 4. B. Use same arm. C. Use opposite arm. D. Turn off 4 pump. Answer: C. Use the opposite arm to prevent dilution from 4 fluids. If unavoidable, Draw below the 4 after a pause. Why must you document specimen collection time? A. For billing. B. To track equipment. C. Some tests require specific timing. D. It's part of handwriting practice. Answer: C. Tests like drug levels or hormone assays depend on timing. Accurate documentation ensures valid interpretation. What could happen if a lavender tube is overfilled? A. Hemoconcentration. B. Under anticoagulation. C. Improper clotting. D. Over anticoagulation. Answer: D. EDTA binds calcium in the blood. Overfilling disrupts the additive-to-blood ratio, affecting results. When should a phlebotomist palpate a vein? A. Before applying tourniquet. B. Before needle insertion. C. After inserting the needle. D. While drawing blood. Answer: B. Palpating helps locate and assess the vein's size and direction. It should always be done before inserting the needle. Which error can alter potassium test results? A. Drawing before breakfast. B. Excessive tourniquet use. C. Hemolysis. D. Using butterfly needle. Answer: C. Hemolysis releases potassium from red blood cells. This artificially elevates the potassium level in serum. What happens if a tube is only partially filled? A. Additive-to-blood ratio is wrong. B. Low blood count. C. No issue. D. Results are faster. Answer: A. Tubes have precise additive amounts. Underfilling alters chemistry and affects test accuracy. What must be done after drawing blood from an isolation room? A. Reuse tourniquet. B. Sanitize gloves. C. Disinfect equipment and follow PPE protocols. D. Use non-sterile tubes. Answer: C. Isolation requires strict infection control. Clean and dispose of gear according to protocol to avoid cross-contamination.